So today's question is, hello, Dr. Paul. I have an issue with excessive masturbation. I did it 6 to 7 times a day, 4 to 7 times a week for the past 8 years. Whenever I feel stressed or under pressure, I think it will be over and I can go home and do it to feel better about everything. Is that considered okay psychologically or not? So first off, it is important to highlight that while masturbation is a normal part of human sexuality, when any behavior interferes with daily life responsibilities or personal relationships, or indeed causes distress, it might be considered a problem. Now, in your case, it sounds like you're using masturbation as a coping mechanism to deal with stress and to deal with pressure. Now, this could be problematic if it's your only means of stress relief, or if it becomes a compulsive behavior, which can lead to a form of sexual addiction. Now, excessive masturbation can also lead to psychological issues like sexual dysfunction, fatigue, and of course other health problems as well. And in addition to that, it can lead to feelings of guilt or shame. And it can negatively impact relationships and responsibilities. If it is getting out of hand and impacting daily life, there are therapies. So things like CBT, cognitive behavioral therapy, can help. And that can help identify and change thought patterns that lead to these compulsive behaviors. There's also psychodynamic therapy, which can address underlying issues related to excessive masturbation, whether they're things like past trauma or difficulties with intimacy. It might also be beneficial to explore some other stress management techniques, things like meditation or yoga. Normally, in high stress situations, I'd say it might be beneficial talking to a supportive friend or family member, but I think in this case you might be reluctant to do that, and that's understandable. Now, all of that being said, this is a really complex issue, and each individual circumstances can vary greatly. So, my best advice to you is to seek out a clinical psychologist for advice, because they can provide you with a proper diagnosis and, in turn, a proper treatment plan. And that will be based on a more comprehensive understanding of your condition. The last place, ironically, I know to get this information is TikTok. So I hope that helps.